Hey friends, this is Natasha.
And Praniti, your fellow med students. As always, the purpose of these short podcasts is to give a quick overview of some topics we think are important for your OB/GYN clinical rotation and shelf exam. Today, we'll be going over Flame Lecture 130, Postpartum Hemorrhage Evaluation.
And as just mentioned, this podcast will only focus on the evaluation of postpartum hemorrhage. However, if you want more details on the actual management and things about massive transfusion protocols, just refer to Flame Lecture 131A and 131B, respectively. So, as the name suggests, postpartum hemorrhage is a pretty scary topic to think about. But why exactly should we care about it?
Well, it's actually the leading cause of maternal mortality worldwide. And even if the patient survives, there's actually dangerous secondary sequelae, such as ARDS, shock, DIC, etc. So it's really important that we pay attention to it. But what exactly is postpartum hemorrhage?
Yeah, so ACOG now has a new definition of over 1,000 milliliters estimated blood loss, or referenced as EBL, or having signs and symptoms of hypovolemia. But there is a caveat that most clinical symptoms actually manifest after a significant amount of blood loss. So usually that's over about 1.5 liters. So it's really important that we recognize the bleeding prior to the onset of symptoms like tachycardia or hypotension.
And honestly, all of this can be really scary to witness. I remember the first time I ever saw postpartum hemorrhage, and I became super overwhelmed with the amount of people rushing in to help this patient. And I just want to say it's okay to stand by the sidelines and watch if you don't have a task directly given to you, because sometimes just standing by is the best way you can help so that you're not in anyone's way.
Exactly. And I also want to note that we previously had other definitions stating that postpartum hemorrhage is over 500 milliliters of estimated blood loss for vaginal deliveries and over 1,000 milliliters of estimated blood loss for C-sections. So you may hear those being referenced or thrown around by some providers during your rotation.
So there's actually two categories of PPH. There's primary and secondary. So primary refers to postpartum hemorrhage that occurs within a 24-hour time frame since delivery. And it can be caused by what we call the four T's: tone, which refers to uterine atony; tissue, which is like retained placenta; trauma, like a laceration; and thrombin, which is like if the patient has a coagulopathy. You can refer to slide 6 for more information about these etiologies. Secondary PPH refers to a hemorrhage that occurs anywhere between 24 hours to 12 weeks postpartum, which I know is a really long time frame. But this can be due to infection, coagulation defects like von Willebrand factor deficiency, retained products of conception, or other reasons.
And while these can all occur at some point, uterine atony right after delivery actually makes up about 75 to 80% of all of the postpartum hemorrhage instances. So I'd say it's pretty high yield and important for us as med students to understand this during our rotations.
But is there a way that we can actually prevent this from happening at all?
Yeah, so following delivery, we should do something called active management for all patients. And this includes a couple of different things. So it's giving oxytocin right after delivery, as well as having someone massage the uterus and also applying cord traction on the umbilical cord.
Right. And the best way is to be prepared. So always assess the patient risk at admission. For example, a patient with a singleton pregnancy with less than 4 prior deliveries, no history of C-sections, or no history of postpartum hemorrhage itself, they're considered low risk. While someone with a known accreta, which is when the placenta grows into the uterine wall, or a known coagulation defect would be considered high risk, so you'd be better prepared.
Exactly. And so this brings us to the end of this short podcast. We just want to say that postpartum hemorrhage, as mentioned before, can be pretty scary to witness, especially if it's your first time experiencing it. So just make sure to check in on yourself. And if you think talking with someone would help, that's definitely something that would be a good idea to do if needed.
Yes, I highly recommend. But anyways, thank you for tuning in. Bye.
Bye.